Hi Emma, thanks for coming to take over from me. I'm looking after Mavis. I noticed that she's got an antenatal risk factor because she's got a raised BMI. I've just taken her temperature and I noticed it's 38, so she's got an intrapartum risk factor for PPH as well. I've got 2 risk factors now.
Okay, fine. So what I'll do is, obviously we've recalculated it. So what I'll do is I'll go out and let midwife in charge know. We'll need to go to delivery unit.
Okay.
We'll put some IV access in. And what we'll also is discuss with the MDT about cross-matching some blood for her.
Brilliant.
We'll also have an active third stage,
Okay.
and we'll have the 40 units of Syntocin on ready for her after delivery. And we'll also have the blood loss weighing scales in and a birth buddy so that they can measure the blood loss for us.
Fab, that's a great plan. Thank you.
You're welcome.
It is important to be prepared for the risk of a PPH. This is done on Epic under Navigator's Admission tab. It is with the other risk assessments and should be completed antenatally and intrapartum. It should be revisited if there is a change in the risks antenatally or during labour. For example, if someone develops pregnancy-induced hypertension or has an intrapartum bleed. Once you have calculated the risk, follow the PPH advice that will come up on Epic. Remember, prevention is better than cure.
Well done, Jodie. Take deep breaths now.
Push.
Keep pushing, keep pushing, keep pushing.
Gloria, is everything okay?
Everything's fine, but I just need a birth buddy. Do you mind being my birth buddy?
Not a problem. Have you got your third stage oxytocin?
I've got it just on the side, but not drawn up. If
Okay.
you can kindly just draw it up and give it when the anterior shoulder is delivered.
Not a
Well
problem.
done, Jodie. Keep pushing. Well done. Well done. Keep pushing, keep pushing, keep pushing. Nice and slowly now.
Gloria,
Now
I've got your
pants,
third stage
pants,
oxytocin.
Take some pants. Thank you so much. Just bear with me just a minute. When the anterior shoulder is delivered, then you can administer it. Lovely. Well done. Head's delivered now, Jodie. Well done. Okay.
Can I push?
Okay. Push now. Push, push, push. Anterior shoulder's delivered.
Jodie,
Well
sharp
done.
scratch.
Well done.
Ooh.
Almost there now, Jodie. Another big push for me. Fantastic.
Wow,
Congratulations. Skin to skin.
Oxytocin 10 international units must be given IM quickly for active third stage management. This should be given at the time as the shoulders deliver, so you will need the help of your birth body. It is important to give ASAP so that it doesn't give time for the uterus to relax. Get the oxytocin ready in the room before the delivery. Oxytocin will contract the uterus and will help the placenta to separate. Wait for signs of separation, including lengthening of the cord or a small gush of blood, before attempting to deliver the placenta.
Zoe, I note we have 400 mils in the graduated drip.
Okay, so from the Inco that I weighed at delivery, we're over 500 mils now, so we've got a PPH. I'm going to call the buzzer
Yeah,
and
that
get us
will
some
be
help.
that will be great. Thank you so much. Brilliant, Zoe.
If there is a PPH over 500 mils or you think that there is a risk of a PPH occurring, pull the emergency buzzer. This is vital to ensure there is enough support in the room to manage the PPH effectively and to ensure that the coordinator of the area is aware of the emergency. Every second counts. Pull your emergency buzzer.
Hi Paddy, you okay? It's a PPH uterine atony.
Okay, Sophie, would you please go get me the PPH trolley and
Can
the
I have
PPH
your
drugs from
hand,
the fridge?
please?
Yeah, absolutely. Purdy, when Sophie returns, would you mind drawing up for me 5 international units of oxytocin to be given IV?
The uterus is still boggy.
Okay, in which case, if you continue rubbing up the uterus, and then Sophie, would you mind drawing up for me 5 international units of oxytocin to be given IV?
Yes, absolutely.
Fabulous. How's the uterus doing at the moment?
Still boggy.
Okay.
Here's 5 international units of oxytocin to be given IV. If you could let Sarah Jane know when you've done that.
Thank you.
Sophie, would you next start preparing for us 250 micrograms of ergometrin to be given IM?
Yes, absolutely.
Oxytocin given already.
Perfect, thank you. Alex, I believe that 40 international units of oxytocin has already been prepared, ready for an infusion. Would you locate it and please start it?
Of course.
Thank you.
Here's ergometrin, 250 micrograms to be given IM. If you could let Sarah Jane know when you've done that.
Thank you. Ergometrin given already.
Thank you.
Okay, so that is 40 units of oxytocin in 500 mils of Hartmann's, running through at a rate of 125 mils over 4 hours. It started running now.
Thank you.
It is essential that we allocate someone the task of rubbing up a contraction promptly as soon as the PPH is recognised. This stimulates the uterus to contract, which can control the bleeding. When a PPH is declared, further uterotonics need to be given. If there is IV access, you can give oxytocin 5 international units IV, which gets into the bloodstream quickly and contracts the uterus. This can be followed by ergometrin 250 micrograms IM to sustain the contraction. You can see that many people are needed to draw up this medication, which can take time. This highlights the importance of teamwork and calling for help early. If there is no IV access, do not delay. Give Sintimetrin IM.
Bunny, I'll just be checking for tears just to see where the bleeding is coming from. You can keep using your questionnaire if that's all right. And Ellie will be just assessing your uterus just to see if it's firm. If that's okay?
So I'm just going to rub your belly. Yeah, it's nicely contracted.
Wonderful. Ellie, I'm not seeing any obvious tears right now, but I'm concerned that the bleeding is getting over 400 mils. Could we do a stop around just for you to have a fresh eyes and take a look?
Yeah, of course.
Right.
Let me just put some gloves on.
Bonnie, you could just keep using your questionnaire. I'm just going to have a feel of your uterus, just ensure that it's firm. All
I'm
right?
just going to carry on checking down below, okay? I think I can see a tear actually. It looks like it's the 2nd degree and quite deep. So let's get the doctors to review it so we can stop the bleeding.
Definitely.
PPHs can be caused by trauma. It is important to recognise any tears quickly and allocate a competent person to suture promptly.
Okay, so let's go through what we've done so far. On this performer, I can see that we've rubbed up a contraction and we've given all of our uterotonics. So what else can we consider?
Can we give TXA?
Yes, Tash, can you please draw up the TXA 1 gram IV?
Yeah.
And Thara, can you please give the TXA and let me know when that's done?
Sure, I will give.
Thank you.
Our ODPs are vital team members in supporting us to care for our women who have had a PPH. Here, they reminded us to use tranexamic acid. Tranexamic acid is an antifibrinolytic agent, so stops the breakdown of clots that have already formed. It is not a uterotonic, but is a very useful part of managing a postpartum hemorrhage, especially where trauma may be a significant contributing factor. Its use is supported by evidence from the women trial, and it is given as 1 gram intravenously by the anaesthetic team.